Good afternoon. My name is Ellen Richards, and I'm Integral Care's Chief Strategy Officer. Thank you so much for joining Integral Care in NAMI Central Texas for today's community forum, supporting your mental health this winter season. Before we begin, we wanted to start with an icebreaker poll. We hope you'll share with us which superpower you would like to have. Your choices will be mind reading, invisibility, teleportation, flying, or I already have a superpower. So as that poll's going, I'm going to check in with our panelists and see what their superpower is. And I'm going to start with Dr. Kelly.
Hi, Ellen. I'd like to say that I already have a superpower, but if I had to choose one from this list, it's going to have to be invisibility. And it's probably not for the reasons that most people would choose this as a superpower. I have a strong belief that a little alone time is very important to me. And so I believe in taking some alone time for my overall health and well-being.
Thank you. Wendy?
I'm with you, Dr. Kelly, but I'd like to believe I also already have a superpower. I oftentimes joke about how when I was raising my children, I was able to cook with one hand, carry a child with the other while running in heels after the other one. But if I had to choose from the poll, I would say teleportation. I have to say I'm not a fan of driving long distances and certainly like to be at places on time.
Great. And Valerie, how about you?
Well, other than the obvious one that's not there, the ability to end the pandemic, I would choose teleportation so that I could go see my 4 grandchildren in Houston and Georgia in any minute that I wanted to.
Yeah, absolutely. We're all missing family and that connection now, which is a good lead into our topic today, how we're working through the pandemic and the winter season. So I'm going to check in and see if our poll is finished. Lady Jane, our behind the scenes helper, is our poll available, our poll results? There we go. All right. So we've got mind reading at 18%, invisibility at 11%, teleportation coming in at 39%. So there's a winner there, and flying at 20%, and then 11% already have a superpower. All right, so some of those folks have already identified what their superpower is. So thank you so much for participating, and we'll get started with our panel. I wanted to let everybody know that we're recording today's forum and that we are streaming on Facebook. Integral Care is the designated local authority for mental health and intellectual and developmental disabilities. And for over 50 years, we have supported adults and children living in Travis County with mental illness, substance use disorder, and/or intellectual and developmental disabilities. I'd like to thank our longtime collaborator, NAMI Central Texas, for co-hosting today's forum. NAMI is dedicated to improving the lives of all individuals affected by mental illness through education, support, and advocacy programs. We're so grateful for their efforts and collaboration over the years. 2020 has been a year like no other, challenging us on so many levels. People have experienced a variety of issues, including depression, anxiety, grief, just to name a few. Culture, background, life experience, and age can all impact how people respond to the stressors of 2020, including the pandemic. Back in March, I know I never imagined the pandemic would still be impacting our communities or how it would mix with the challenges of winter or disrupt the holidays. Today, our goal is to share information and tools to help you, your loved ones, friends, and neighbors cope with the issues that can arrive with winter, as well as navigate the uncertain times in which we find ourselves. So let's get started. I'm honored to introduce our excellent panel. Thank you for taking the time to share your expertise with us today. First, Dr. Calvin Kelly has over 25 years of teaching in undergraduate and graduate psychology and counseling experience, most recently serving as dean and professor at St. Edward's University. He also has 29 years of experience in private practice as a licensed mental health professional, and he's practicing today. He has presented nationally on trauma and post-traumatic stress-related issues, racial identity, development, men and depression, secondary trauma, holistic wellness, organizational development, and leadership and team building. Welcome, Dr. Kelly.
Thank you, Ellen.
Valerie Milburn is an active recovery and mental health advocate in Austin, sharing her expertise since 1999. As a person in long-term dual recovery, Valerie devotes her time to reducing the stigma that surrounds substance use and mental health disorders. Valerie is a volunteer with NAMI Central Texas and a member of the Board of Directors of Communities for Recovery. Welcome, Valerie.
Thank you, Ellen.
And Wendy Salazar is a practice manager for adult behavioral health and child and family services at Integral Care and has worked in the field of integrated behavioral health for over 11 years. Prior to joining Integral Care, Wendy served as a program director for a 16-bed facility for displaced youth and provided trauma services for women and children. She specializes in women and children's mental health issues, depression, and trauma. Welcome, Wendy.
Thank you.
So we're going to start with a panel discussion and then move to questions from the audience for the last 10 to 15 minutes. And as best as we could, we've incorporated questions that we received into the panel prior to the start of today's forum. If you do have a question, please type it into the Q&A box at the bottom of your screen, and we'll do our best to get to as many questions as possible. So let's kick off the panel discussion. Wendy, let's get started with you. Help us understand the impact of the pandemic on our mental health and how this is compounded by the onset of winter. Some people are experiencing adjustment disorders. Can you help us understand what those are?
Yes, certainly. So certainly the COVID-19 pandemic has induced an increase in stress for people. Fear and anxiety about the new disease, the impact it can have on the community can be quite overwhelming. And you couple that with the urgency in ensuring that we take public health actions such as social distancing, can make people feel isolated and lonely, which in turn exacerbates the stress and anxiety that we're already feeling with all that's happened. People ultimately respond to stressful situations differently, and adjustment disorder is a stress-related condition. When we experience more stress than we do normally, say, for example, the unanticipated loss of a loved one, the situation that we're experiencing right now with the pandemic, the stress related to the event can cause difficulties in our relationships, with work, with school. In most cases, however, people experiencing adjustment disorder can adjust to such changes within a few months. In circumstances such as the one that we're facing with the pandemic, we continue to experience emotional and behavioral reactions that contribute to feeling anxious and ultimately leading to symptoms of depression. And that is because COVID-19 is still present. We are still having to navigate its presence. And although situational depression in and of itself is not a technical term in the field of mental health, when we're faced with unresolved situational stressors, we can sometimes develop depressed mood. Similar to adjustment disorders, situational depression comes on as a result of being unable to manage the stress related to an event that then brings on these symptoms of depression. This type of depression, we sometimes can hear it be referred to as a stress response syndrome, if you will. Another type of depression that is common during the winter months, which can certainly be exacerbated by the impact of the pandemic, is that of seasonal affective disorder. It's also known as SAD. Seasonal affective disorder is a period of major depression that most oftentimes occurs during the winter months. Our days grow shorter and we are less exposed to sunlight during these times. It typically does subside when the spring and summer seasons roll around. SAD affects about 5% of adults in the United States. And although we don't quite fully know the impact that COVID will have on individuals who experience SAD, what we can assume this year is that individuals may experience SAD symptoms for the first time, who may have never experienced SAD symptoms before. Those individuals who are already aware that they are more sensitive emotionally during the winter months may have to start to self-care and prepare and plan for maybe an increase in symptoms.
Great. Thank you so much, Wendy, for all of that good information. I'm going to move to Dr. Kelly and help get some information from him. You support children and families in your practice. And can you share some of the unique challenges that they are facing today?
I can, Ellen. I want to take a step back, if I may. Prior to the pandemic, it was estimated that 1 in 5 or 20% of school-aged children had a diagnosable mental health issue. Now we're looking at data that's coming out of Penn State University that's reporting those numbers are now closer to 33 to 38%.
Wow.
We're seeing that COVID is truly having a tremendous impact on youth in today's world. And just like what we're seeing in our youth, adults are starting to report elevated levels of adverse mental health issues. They're also reporting an increase in substance use and abuse. And as well, we're now starting to get suicidal information that adults are reporting that they're experiencing suicidal ideation twice as much as they were same time last year. Now, to be clear, these statistics only give us a snapshot of the short-term impact of COVID-19. The long-term consequences are something that have yet to be determined. And the final synopsis is that many, if not all of us, are struggling in some way, shape, form, or fashion. The one thing that I want to caution parents of children about at this time as we struggle with the whole COVID pandemic, and that is the adultification of children. We have got to let children be children, and we've got to realize that children are not necessarily going to have the skill set, the communication skills that we have as adults. And so we can't expect that children will come to us and report what it is that they're experiencing.
Right.
So we're going to have to go to our youth and to make sure that we're providing them with the necessary comfort, the necessary support, so that as they are experiencing COVID-19, experiencing isolation, experiencing issues around complicated grief. And I really want to highlight the complicated grief part, because we've got to realize that our kids, as well as the adults, have lost a sense of what was normal.
Right.
And we've got to take some time out to grieve that loss. We all have to realize that we are experiencing a new normal, and that this has totally just turned our world upside down in our heads. And so helping our kids to be able to identify their behaviors. We need to realize that they may not be able to communicate that I'm feeling anxious or that I'm feeling depressed. Those behaviors may manifest themselves in terms of irritability, isolation, not, school refusal, and not wanting to do anything. And so I'm encouraging all parents to go to your student and say to them, hey, I'm going to assume that this has had an impact on you. Let's talk about what exactly that impact is on you at this time.
That's great, Dr. Kelly, and so well spoken. So that's a great strategy, really, like parents going to their, doing that outreach and just making the assumption that the impact is there. Can you talk about other strategies that you are using with your clients that you feel would be helpful to our audience today?
Absolutely. In addition to you being the adults starting the conversation, really helping kids to unplug, we got to realize that all of us now are operating in this virtual world. We've got to step away from this virtual world. We've got to step away from television. We've got to step away from media. All of those things are contributors to our anxiety. They're contributors to our depression. To my colleague, Wendy, what she was saying, we've got to get people outside. One of the causes of situational or sad as it is that we've got to get sunlight. We've got to get some sun on our face, because part of that is our melatonin levels, because the winter time brings about less sun, our melatonin levels are increased. They're much higher. And what happens in correlation with that is that our serotonin levels are much lower. So we get outside as much as we can with our kids. We've got to get them back to being kids, riding their bikes, really helping them to sit down in a calm space. As I said, I wish I could be invisible as my superpower. I think we've got to let kids also go into a space where they can learn just to sit and be still. There's so much that's happening, and we're in such a rat race, and our minds are going at 100 miles per hour. We've got to teach them how to meditate and just to be in a space. We've also got to bring that family unit back together. So I'm encouraging families not to sit around and watch television, but to go out and invest in board games or to be creative and let your kids do some drawings, just some freehand or doing a journal or something of that nature, where we can really get them back in touch with their true essence of who they are and help them to realize that what we're experiencing right now, there's nothing normal about it and it's okay, but together we can get through this as a family.
I love that, getting back to the essence of who they are. That's really core to so much of this, isn't it? So thank you. Valerie, I'd like to move to you, and you have lived experience with mental health challenges. And you mentioned recently that you've experienced depression during the pandemic and hadn't for many years. So kind of lost some sense of your essence, it sounds like, but that you also had the tools to manage it. Can you tell us what has helped you during this difficult time?
Yes, I can. And I did, for the first time in a long time, fall into a depression at the very beginning of the pandemic. I live in recovery with bipolar disorder and substance use disorder, and I have lived a happy, healthy, purpose-driven life for many years. The pandemic threw me for a loop. The stay-at-home order came, in-person volunteer opportunities disappeared, in-person 12-step meetings disappeared. I couldn't see my friends the way I had. My 60th birthday trip was canceled. And my world, just like many others, nearly everybody's, was turned upside down. I felt isolated. I had my normal good morning God turn into a feeling of good God, it's morning. And it seemed like I was either angry or crying, both of which are symptoms of my depression. So I know enough about my mental health condition that I knew it was time to reach out for help. So I called my psychiatrist and we made a plan. And these are the things that helped me. I started monitoring my sleep very carefully. I make sure I don't sleep too much or too little. I made sure I was productive, even if it was one little task after the next. I made sure to keep up my exercise routine. I had let I never strayed from my morning meditation, but I had let my mindfulness practice go out the window. So I refocused on that, staying aware of what I was doing, whatever it was in the moment. And my psychiatrist made a small medication change. There were a couple of other things that happened that really helped me. NAMI volunteer opportunities became available again by Zoom, and 12-step meetings became available by Zoom. And another thing was, as I reached out for help to friends and family, I found out that others were struggling as much as I was. And that gave me the opportunity to offer compassion and support. And as always, getting out of myself and being of service was very healing. I dug my way out of that depression, but the pandemic has been very challenging for me, and I've had to use all of my tools that I mentioned every day to stay mentally healthy. I know that the anxiety I'm feeling now and the occasional low moods are something I can handle because it's caused by the situation of the depression, or I'm no longer overwhelmed and feeling fearful. I am not feeling the fog and the dread and the anger and the molasses in the blood feeling of depression. But the holiday season is bringing some low mood and some anxiety. Everything is different this year. And there's sadness and grief over the absence of family. But I have some tips. And the first one is mindfulness. To stay in the moment for me is key. To not project about the uncertainty of the holiday and the worry of what it's going to be like. Finding joy and gratitude in any given moment is key for me. And I had a wake-up call from the universe recently. I was sitting outside feeling low, and a butterfly landed on me. And it was such a reminder of the importance of finding joy in the moment. But the real tools I'm using right now is to focus on what I can do, not what I can't do. And I can know that just because it's different this holiday, it's not bad. And I can continue to celebrate the traditions that are still available to me. I can keep up my exercise and meditation. I can decorate my patio instead of my house, because my patio is the only part of my house anybody still sees. And even though the dining room chairs around us are going to be empty, I can still celebrate the grace of a 38th Christmas dinner with my husband.
What a nice thought that 38 years, that's a long time.
Mhm.
And I think you make a point that's so critical to underline, and that is a toolkit. That during a time like this, having a toolkit, your own individual toolkit, is so important. You know, whether it be reaching out to others and supporting them, as you mentioned, or those mindfulness practices, things that you know work for you. And it's so critical to build that toolkit and remind yourself that it's there for you when you need it most. So Valerie, I wanted to do a follow-up with you. Given your unique experience, do you have suggestions for people diagnosed with mental illness who might be facing addiction issues during this pandemic or using substances?
Yes, and Dr. Kelly gave some of those statistics about the increased frequency of addiction and alcohol use during the pandemic. And I know for me, the most important resources in my sobriety have been Communities for Recovery and NAMI. And Communities for Recovery in particular, and we'll put that information up in the resource slide, has a dual Recovery Anonymous meeting where it's a safe place to share about both substance use disorder and mental health disorders, and it meets Tuesdays and Fridays. I'm giving specific resources here. They also have a wellness action plan meeting, and they have a wellness assessment meeting, and all of this is available on their Facebook page and their website. And NAMI has a workshop called Stories and Strategies. And this Monday night at 6:30, the topic is strategies and skills for living with the mental health condition, including substance use disorder. And you can register on the NAMI Central Texas website. And also the Austin Clubhouse has video chats available right now. So those are 3 resources, and mainly it's to reach out for help. We can't get better alone.
Wonderful. Those are great, great suggestions. And we will have that resource page up at the end of the panel. So thank you for highlighting those 3 important opportunities that are coming up. So we know the pandemic is having a greater impact on some communities. The systemic health and racial inequities associated with the pandemic are in full view, with higher infection and death rates among Black and Latino communities. So I'd like to just check in on these topics specifically. So Dr. Kelly, can you share with us how the mental health challenges are manifesting in the Black community, and what kind of support does this community need right now?
Absolutely, Ellen. You know, I think we all realize that the pandemic has once again put a spotlight on the fact that the Black community, as you put it, was disproportionately impacted by COVID-19. One of the things that I just want to note, and I'm not trying to give a lot of statistics or data, the Black community right now constitutes about 12% of the US population, but we are deemed to be overrepresented in what we call those high-risk populations. For example, approximately 40% of the homelessness that's experienced in the US are by people of color or Black people. The community represents about 50% of the prison population, and approximately 45% of the children in foster care are Black. Now, removing all of the aforementioned factors, data still has a way of pointing to the fact that Black adults are reporting that about 20% of them are experiencing serious mental health issues at this time. So with that said, Ellen, let me take a deep dive, if I can, into some of the inequities in those social determinants of health that are putting Black folks at an increased risk for getting sick or dying of COVID, as well as developing a serious mental health issue. You know, one of the things that we'd like to think is that discrimination or racism no longer exists in America. The reality of the situation is that discrimination, which includes racism, can often lead to chronic and toxic stress. And that shapes both the social and economic factors that put people at an increased risk for mental illness. Coupled with that, access to healthcare continues to be an issue for people of color. We've seen that demonstrated time and time again. We're seeing it now in the age of COVID, if you will. Black folks don't have access, and that can be limited because of transportation. It can be limited around childcare, the inability to take time off from work. We've got to realize that as healthcare providers, there can also be communication and language barriers. And then we just go back to the basic distrust that Black people have in the healthcare system overall. There's a lot of research that's coming out of the CDC right now that is asking whether or not people of color, Black people in particular, will go and get the COVID vaccine once it's made available. That's concerning, that you have a large percentage of African Americans who are saying they will not go and get the vaccine when it's made available. And part of that is related to this distrust in the healthcare system. But the other factor is that because they have been discriminated against in both mental health and healthcare, that is a contributing factor to this decline in our overall health and well-being. The other thing that we have to take note of is that Black folks are pretty much a large part of the essential workforce that we see. So a lot of them are frontline workers. They're in healthcare facilities, they're in the grocery stores, they're in factories, and they're working in public transportation. Now, many of these positions don't allow people to work from home. So they're on the front line day to day, putting themselves at risk. And what I'm experiencing in my own practice is a large number of them are reporting high levels of stress, high levels of anxiety, and depression because they feel like they're being put in a situation that's not safe. They don't feel personally safe. They feel that when they leave their home, they have to come back to a home and they don't know if they've been exposed. There may be someone in the home that's immunocompromised already. And the reality of the situation, they're dealing with that on top of the fact that they may be putting their family member at risk for death. So when we look at all of those things, stress is a major, major contributing factor to what African Americans have experienced in America for a long time. And it was one of those major contributing factors to our overall health and mental health and well-being. And so with that said, one of the things that we have to consider in terms of what can we do now to support a group that is disproportionately being affected by mental health issues, that's being disproportionately impacted by health-related issues, is that we've got to understand and support our communities of color as best as we can. We no longer need allies in those communities. We need what are called accomplices. We need people that are going to be there and that are going to say, I'm going to walk this walk with you, and I'm going to be in this fight with you. And the reality of the situation is, and as Valerie has pointed out, stigma continues to be a major factor in access to mental health care. There are still a lot of people of color, Black people in particular, that will not go to a mental health care provider because there's a lot of stigma around being called crazy or being misunderstood in the Black community. So we need people who are culturally competent. We need more Black mental health providers, but we also need those mental health providers that are out here working with people of color right now to really make sure they check in their cultural competence, to make sure that they're building the trust in that community and that they're understanding what people of color are going through. The other thing that I would say is that we've got to, in our position, to make space, especially people in the white community, make space for people of color, especially Black people, and don't take that space away from them. Lend your voice to the fact that if you see an injustice or if you see racism, you're going to be the person that speaks up about it. When we look at COVID right now, in the day and age of COVID, we've got to realize that this situation is really complicated. Black people are not only dealing with COVID in America, they're dealing with violence, they're dealing with racial inequities, and they're dealing with homelessness and a lot of issues. And so all of this coming together is really taking its toll on the Black community. And we have got to be out there on the front line, supporting them as best as we can, making sure that resources are available, and more importantly, making sure that they are aware of those resources. So whatever it takes, if that means we need to go into those church communities, if we need to get virtually involved with local churches, which is where a lot of Black folks go for their mental health. And I am very proud of our pastors are really starting to get on board and really starting to understand where their scope begins and where they have to refer people to someone else. But we have got to support communities of color as best as we can, because literally lives are at stake.
Right. Thank you so much, Dr. Kelly. It is such a complex and deep issue that's so many things coming together right at this time. And I agree that we've seen some amazing examples in our community of faith leaders coming forward and sharing their own stories of mental health challenges and setting that example and sharing their stories so that others can know that it's safe to get the help that they need. And I think the key thing is like us coming together as a community and everyone supporting each other, regardless of what our race or ethnicity is. So appreciate you sharing the deep complexities of what the Black community is facing today. Wendy, talk a little bit about the mental health challenges within the Latinx community and what are the kinds of supports that community needs at this time.
Absolutely. So one thing to consider, and what we do know right now as far as what the research shows, within the Latinx and Hispanic population, adults and youth are oftentimes more susceptible to mental health distress related to immigration and acculturation. And then you couple that with the impact of what COVID-19 is currently doing. We're talking about the social distancing, and immigration is already creating those types of barriers. And now the worries and concerns around, when will I be able to visit and see family? What if I don't have access to internet or some type of a social media platform? So those are some of the considerations right now to think about. Another area that is particularly of great concern is equally important to know is that individuals of the Latinx and Hispanic population are more likely to seek help for a mental health need from a primary care provider rather than a mental health specialist. And this is often the case because they will oftentimes focus on the physical symptoms of the mental health condition rather than the psychiatric symptoms. So this is very important when it comes to primary care settings, understanding how crucially vital it is to be assessing for mental health concerns within the Latinx and Hispanic community. Language is another huge consideration in working with the Latinx and Hispanic population. Poor communication with health providers is oftentimes an issue. It's unfortunate, but there is a shortage of bilingual or Spanish-speaking health professionals, period, let alone mental health professionals. Bilingual patients are evaluated differently when evaluated in English versus in Spanish. And the Latinx and Hispanic community are frequently going undertreated because of this.
Yeah, and it's so important to have professional translators available to support people who are upfront speaking other languages rather than relying on family members to do that kind of translation. It really is critical for providers to have access to those professional supports. And two, that issue of connection, we've talked about that over this panel, that difficulty of feeling connected, especially if you've got family in other countries that you can't reach, that adds that layer of complexity and difficulty for that population. So thank you. Valerie, as we talk about ways to support specific communities, how can someone who has a loved one with a mental health issue best support them right now?
The first thing that comes to mind is how dangerous isolation is for me. So I think one of the most important things at this point is just to stay connected, just like we just talked about, to reach out, call, Zoom, FaceTime, Skype, text, email, any and all of the above. Just stay connected any way you can, whatever works. Also, to encourage your loved one to reach out for help. I didn't get better alone. Treatment was necessary. I needed help from friends, family, professionals. And also, extremely important is to listen. Just listen. Brene Brown has an empathy video where she shares something that I like to share. She says that sometimes it's okay to respond by saying, I don't even know what to say right now. I'm just glad you told me that. Again, the power of connection.
Absolutely. Like just creating that space. I think Dr. Kelly mentioned creating space for people, and that is so important, just to create that space and hold it for them while they're struggling, even if you don't know exactly what to do. We've talked about tips and tools to manage our current environment, and sometimes we need additional support, and I want to move to that. How do we know when it's time to reach out for help? So anybody want to weigh in on that? Dr. Kelly?
Sure. I think about it. I look at it like this, Ellen. The reality of the situation is that most of us will go and get our annual physical. I believe that we need to go and get a mental health checkup at least once a week, and we just need to make that a part of our routine. I think it's something that we need to implement in schools. I think it's something that we as adults need to make sure that we're taking care of our own mental health and well-being. James Baldwin said it best: children may never do what you tell them to do, but they will always do what they see you doing. And we've got to realize that if we demonstrate early that mental health, mental well-being is important to our kids, that is something that we can model for them right here, right now. And they'll pick that mantle up and they'll run with it. And the next generation will do the same thing. And so I believe, especially again in the Black community and communities of color, that we wait until the situation has really become something that we can't deal with, or something that needs to be handled, where the person needs to be hospitalized. The signs and the symptoms are generally there. We know that early onset, or we know that there's a period of time that people are more likely to develop a mental health issue. And that's between the ages of 16, a serious mental health issue, between 16 to 24. That is a period of crisis. The adolescent is going through identity development, and that's a period of time where they're moving into middle, high school. And so we know that that's a period of time. I think early on, or as early as we can, we just need to get our children exposed to talking to someone, talking through their feelings, and just really being well.
I know.
Go ahead, Valerie.
Thank you, Dr. Kelly. I know my own signs of when it's time to reach out for help include a sense of dread, not wanting to shower, overeating, feeling angry because I'm not usually angry, not exercising, not being able to quiet my mind during my meditation, and crying easily or frequently. And I do see my psychiatrist once a month at that normal checkup time that Dr. Kelly just mentioned. And at the beginning of the pandemic, we switched that from monthly to weekly through telemedicine. So I do get that regular mental health checkup.
And if I may also add,
Yep.
I agree wholeheartedly with both Valerie and Dr. Kelly in that we really need to normalize emotions, emotional health. I oftentimes argue that, hey, I'd rather call it emotional health or emotional well-being because it is part of every one of us. We are wired to emote, and to acknowledge that and to welcome that is important, because once we start to cue in on what we do normally when we're emoting over a situation, we can then pay attention to what it looks like when it's happening more days than not. We're more able to understand and recognize what really does it mean for me to have a sense of hopelessness or helplessness in a situation. Because automatically we're wired to try to problem solve the situation, which might have some influences to why we wait before the problem becomes worse, before we get help, because naturally we want to fix the situation. But if we can establish a sense of what emotions look like for us as individuals, it'll help us to be able to identify when it's time to reach out or even incorporate it as part of our everyday well-being.
Absolutely. Getting back to that question of essence, like what is our essence? And that includes our kind of our emotional state, right? And what do we know about our own emotional states? Well, one thing I want to just reiterate is something that Valerie mentioned, and that is for a loved one that's looking to know whether they need to seek help for someone else. And that is like, a significant change in personal appearance, behavior, activities, not having that usual interest in things that they have interest in, or giving away things. So really monitoring, to see what someone else is doing. And if you're concerned about it, reach out for help. And we will put up those resources at the end of the panel. So we're getting close to our Q&A, and I want to just see, there's one more question before we go there. So we've experienced so much loss this last year, and many have lost family members, loved ones, or friends. And what are the ways that people can help themselves or support others when they've experienced a loss? And I'll let anybody that wants to jump in on that. Anybody?
Well, first thing that comes to mind for me is self-care. Take a bath with candles and essential oils, go for a walk, rewatch your favorite movie. I mean, these are, again, coming from a person who lives with the mental health condition, that's the first thing that comes to mind for me. And unfortunately, my self-care is baking. And so I'm packing the pandemic tin, but it's a serious topic. And I just know that that's one of the things I have to do, is take care of myself in any situation like that.
Yeah. Indeed.
I know we speak a lot about trying to stay connected, and staying connected virtually, I think is something that's very big right now, right? Because that is a mechanism of being able to stay visually connected with our friends and loved ones. But I've also want to acknowledge that, there are some circumstances in which we might be feeling screen time burnout and not really have the desire to want to, I just shut off for work and I don't want to get back on the screen. I want to see my family. I want to see my brother, my mother, my sister, but gosh, to turn that screen back on again, it's just overwhelming. So what might we be able to do in between so that we don't lose the opportunity to connect with the family that we have scheduled at 7 o'clock this evening? That goes back to developing a routine outside of our home. What can we do? Can we go for a walk? Can we jump on the trampoline with our kids? Back to what Dr. Kelly was talking about, how we want to engage those conversations, but we too, as adults, want to actively partake in them. If we're going to introduce the idea of a coloring sheet, there's coloring adult sheets for us to do. Might we do that outside while we're, absorbing some of that vitamin D from the sun? What can we do in between our screen time to help us kind of recharge that battery for staying connected virtually?
Dr. Kelly, one last minute on supporting those who've experienced loss?
I'm going to go back to what I said earlier, and that is you've got to allow yourself to grieve the loss of what was normal. And you've got to create a new norm for yourself. We've got to realize that we don't know if and when we're ever going to get back to this new norm, to a new normal, or back to what was normal. I don't think we're ever going to get back there. We've got to grieve that loss because that is so important. And we've got to recognize that that grief process for each and every one of us could look different. But I do believe that as we are grieving that, we've got to create some new norms for ourselves. We've got to create some new things that we can really hang on to and really create that we can look forward to doing.
Great. So just to kick off the Q&A, I wanted to just start with one question that we've already know we have, and that is, we know there are proven ways that people can build their own resilience and reserves, and y'all have talked about a number of things today that can help us better weather our life storms. If there's one thing you could do right now to help yourself or someone you love, what would that be?
I'll kick it off.
Valerie, yeah.
The one thing I could do right now is something I do frequently. I could make a gratitude list, and I can always come up with a couple of things. Right now, I can be grateful for having been here today. It's been an honor. And the fact that my family is healthy in the middle of a pandemic. And the fact that I have four beautiful grandchildren that I still get to see, 2 in person and 2 by FaceTime. It's my gratitude list at the moment.
Yeah, that's something I've started this pandemic, and it's really helped me a ton. Wendy?
I would really encourage people to think about activities that we can do outside of our home, in the backyard, in the front yard. I loved, Valerie, when you talked about decorating the porch. I love that. That is awesome because we stay connected with some of our traditions. We naturally and normally during this time of year will decorate the front yards. And how can we really, take that and give that a new essence with the current climate that we're in. As much outside time as we possibly can is incredibly important. So that would be one thing I would encourage people to do now.
Great. Dr. Kelly, one thing for you or a loved one?
I would rewrite our script, realizing that we totally control whatever our narrative is. So I'm huge on helping people to rewrite the script and not to keep playing the same loop over and over. So taking stock, I love what both Valerie and Wendy said. I learned that from my son. We're sitting at the Thanksgiving table and he says, "Dad, I just want to talk about what I'm grateful for and what I have presently." And that was so powerful. And so we can all rewrite a different script and we don't have to keep playing the same script over and over.
Yeah, that's so important. Like stopping that, that normal pathway you use in your brain, like stop yourself and develop a new pathway for a new message. That's absolutely so important. So I want to go to the audience questions, and I've got one here that's fairly long and complex, and I'm going to try to summarize it. So someone writing in asking about a teen that identifies as LGBTQ and is Latinx, and also on the autism spectrum. So a lot of things there, 17 years old, and really having some depression symptoms, the kind of having some sense of panic and hopelessness given all that's been going on around the political environment, COVID, sexual identity. So they're aware of the Trevor Project, but they want to know if there's anything out there for teens that are struggling with the racial inequities that are prevalent in our society today. Any thoughts on that? So resources for a teen struggling with racial inequities. Dr. Kelly?
The first thing I was just going to say, and I was going to defer to Wendy or Valerie, the first thing I was just going to say is just get them connected to someone that's competent first and foremost. Even if that means a family member, if the family member is supporting their transition or their identity as they're going through that identity model, just make sure that this person has someone that they can speak with. And if you as a parent don't feel comfortable having that conversation or that level of communication with them, then reach out to some of the resources in the community or reach out to someone on the panel here and get them connected so that they can have someone that they can talk through this with, and they're just not living in isolation, having to deal with this, having to try to go online and find some support, but get them someone where they can really have a conversation about what they're experiencing at this time.
Yes, that's wonderful. And one of the best places to find those resources is through NAMI. NAMI has a list of resources that is very long and very thorough, and a great place to go for resources. And it's namicentraltx.org, and it'll be on our last slide.
Okay.
I'd also like to take the opportunity to talk about our helpline, our local helpline. Our helpline it's not reserved for crisis situations. It's reserved for anybody who is looking for resources, looking to speak with another individual, mental health professional in the field, to discuss concerns or areas that for them are important to further expand on. Like, for example, if it's a caregiver who's needing some resources on how to support their youth, that would be a fantastic use of the helpline, or even modeling using the helpline for our youth who is going through the hardships that they're experiencing. So the helpline is a great resource as well. It's a good way to segue to a multitude of resources, both locally and nationally.
Yeah, and also that text line, the crisis text line, I think might be another good youth resource, and we'll have that at the end.
Yes, I was going to suggest that as well, the 741 number.
Yeah. So Wendy, I'm going to kick this to you, but anybody else can weigh in. So what suggestions do you have for individuals who are homeless or do not have access to a phone or email? How do they stay connected with others and also to seek help?
Yeah, so Austin community is a wealth of resources in terms of services for our homeless community. There's a lot of outreach services that are currently in effect right now. And I would highly encourage any individual who is experiencing homelessness or is at risk for homelessness to seek out resources in the community, such as outreach workers that make themselves available every single day in order to be available for providing that support and to engage. There's a lot of programs available out in the community that our outreach workers can help facilitate connection to.
Yeah, a couple of specific things that I think of are Sunrise Church down on right off of Ben White, close to that Ben White Lamar area. There's the clinic at the community care clinic at First in Ben White might be another possibility, or also maybe the Arch downtown might be an option. But I do agree there are a lot of outreach workers out there. It's just, but those are some kind of like set places that people might be able to reach out for help. Any other thoughts on that from anyone? Okay, so moving on, for people who don't have insurance or don't have coverage that allows them to see a mental health professional regularly, what advice would you offer if they are in need of long-term professional help with mental health? Great question. Anybody?
Go ahead.
I was just going to simply say, again, referring to our helpline. Our helpline, again, is not just reserved for mental health crises, but rather it's also available to help individuals connect to resources regardless of their financial standing, insurance, or lack thereof. It's a great way to connect to community resources that help individuals get connected to resources to help with receiving services and resources to help pay for such needs.
And again, NAMI has so many programs, and all of their programs are free. Many programs available for families, from family members supporting those with a mental health condition and for peers living with the mental health condition. And go to the website. There are many programs available. Again, all of NAMI's programming is free.
Yeah. As we're
Also,
oh, go ahead, Dr. Kelly.
Also, just wanted to point out that one of the misnomers or some misinformation is that there are a lot of private practitioners that dedicate a certain percentage of their private practice for people who can pay or put the sliding scale. So please, if you reach out to someone in private practice, just let them know that you can't afford to pay, and you might be shocked and surprised that, again, a number of them have dedicated 10 to 15% of their practice is for no pay or sliding scale fee.
Absolutely, so much generosity in the community, the counseling community. As we're in Austin, and I'm not sure if this person is writing in from Austin, I will say, you know, we do have some local systems, such as the Medical Access Program, which is through Central Health, that offers some access to mental health services, and they're connected to systems like Community Care, Lone Star Circle of Care, and People's Community Clinic, all of which offer mental health services in their primary care practices. So that might be a resource, as well as integral care. We're available at no cost or sliding fee scale. So I'm going to go ahead and wrap up. This time has flown, and y'all have provided so much amazing information. I want to thank each of you. I know it's a lot to prepare for this and to take time to do this with us today. And I thank you so much. It's been so informative. We've learned so many good tools and strategies that I hope people can take home with them as they're navigating what lies ahead for the holidays, the winter, and the pandemic for however long it lasts. So I just want to thank Valerie and Dr. Kelly and Wendy, all of you, for being with us today. And I would like to now pass it over to Karen Reynes from NAMI Central Texas to really wrap this up and just share a few thoughts with us. Exactly. Hi, Karen.
Hello, everyone. My name is Karen Reynes. I'm the Executive Director for NAMI Central Texas. And wow, what a treat it has been to listen in this last hour. Thank you to our panelists who have just been amazing. What an hour full of wonderful ideas, skills, inspiration. So thank you so much to our panelists. You've done such a great job. And I know that everyone is so thankful for your time and your energy that you gave to this. And then I also want to thank everyone who joined us today. Because really, as we have reiterated over and over again, this is such a challenging time. And it's so important that we all talk about how challenging it is and what we are facing ahead. And it's really especially important to talk about all the tools and resources that are available to support not only ourselves, but the people that we love. So I just want to reiterate that during this really stressful time, I think each of our panelists alluded to this, how important it is to pay attention to those signs that we may need help, not only in ourselves, but also in others, and then to reach out and get the help. There is going to be a slide immediately after I finish speaking that has all of those resources available that we've been talking about, that you've been hearing. And so I do encourage you to take a screenshot of that if you like, so that you've got that information. But likewise, you're going to get a follow-up email that's going to contain all of that information. And it's also going to have a really short survey. If you can just take a moment to fill out that survey, it's so helpful to get your feedback. Once again, I just want to thank all of you for joining us. I want to thank Integral Care for being such a wonderful partner in the community. It's so wonderful to be able to elevate these important conversations in our community during this really difficult time. So everyone, be well, stay healthy, stay safe. We look forward to seeing you at the next community forum. Bye-bye.
Thanks, everyone. Take care.